Hey everyone. Thank you so much for joining us for our next campfire chat. Tonight we are joined by a special guest, Dr. Sarah Nelson Taylor, who is a board member at Nevus Outreach, a Nevus mom, and a pediatrician. And we are excited to have her talking with us tonight a little bit about um, policy that's impacting CMN right now and just what we can do as an EVIS community to understand that and take action collectively. So welcome, Sarah. I'm so glad you're here.
Hi, thanks for having me.
I guess we'll start just setting the stage a little bit. Can you tell us a little bit about your story, how you became involved in EVIS Outreach and joined the CMN community, and a little bit about your professional background?
Yeah, so we joined the CMN community by storm about 18 months ago when our youngest daughter, Nora, was born in January 2024. She was born with a giant congenital melanocytic nevus, like a bathing trunk nevus, and has NCM. Her initial course was a little complicated because she had large tumors that had to be removed immediately after birth. So we were kind of in the throes of it very quickly. And kind of after we initially kind of recovered from the initial kind of shock and awe of that situation, we got involved in Nevus Outreach and attended our first conference last summer. And we're just blown away by all of the support and advocacy that the organization was doing. And so have been, the rest is history, I guess.
Yeah, yeah, to some degree. And then tell us a little bit about your just professional background.
Yeah, so I am a pediatrician. I have an MD PhD, and my PhD is in cancer biology. And I actually studied the RAS MAP kinase pathway and NRAS Q61K mutation specifically as part of my PhD research many years ago. But we're very familiar with that science when Nora was born. But I am a board certified pediatrician, and I am just in 2 weeks finishing up my pediatric nephrology fellowship, and will be joining the faculty at the University of Colorado or Children's Hospital of Colorado as a pediatric nephrologist interested in precision diagnostics and precision therapeutics.
And I always say that the universe sends us exactly who we need, exactly when we need them. There's just always, it seems to be a power at work that really just orchestrates everything so beautifully. So we're so thrilled to have that expertise at the boardroom table now. And I just have a few questions. That's totally fine. Um, I just have a few questions regarding kind of our public policy and just things that you've brought to our attention and kind of alerted the board to and the organization as we look for things to advocate for and really try to keep our families on a path that where they feel supported and this and the science into our condition is supported as well. So, from your perspective, what are some of the biggest challenges families face when navigating care for children with rare conditions like CMN?
Well, I think first and foremost, we have even if you know the system, it's a complicated system. So, navigating and getting a child multi-subspecialty care is a part-time job, if not a full-time job in and of itself. Being able to figure out how and when to get to big academic medical centers, how to coordinate appointments, how to figure out how to ask the right questions. And so the complexity of our system doesn't do parents favors. And so I think one of the most important things is for parents to ask for help when navigating that system in the form of social workers within dermatology offices, asking your local pediatrician about, if they have tips or tricks for how to best go about getting the care your child needs. Everyone is here to help you, and sometimes we forget what we know that parents don't know.
That's right. Yeah, so for a little more on access, I know we're going to have another campfire chat coming up next week where we'll kind of deep dive into that more specifically. And the other side of that coin that I want to make sure we highlight tonight is about current public policy.
Right. Right.
So, and just funding decisions. What kinds of public policy and funding decisions need to be on our radar as the Nevis community right now?
Yeah, I think I could go on forever about this. There are many different areas in which we need to be aware of the changes and decisions that are being made at the level of the federal government. First and foremost, 50%, if not more, of America's children are on Medicaid, which means that 50% of our Nevus Outreach kids and our CMN kids are relying on Medicaid, either as a primary or secondary form of insurance, to get the access to care that they need. So any cuts to Medicaid are going to directly impact our patients and our communities. And beyond that, cuts to Medicaid impact all kids' ability to get care, because you have when you lose 50% of your payer source, rural hospitals, pediatricians' offices, big academic children's hospitals are unable to continue services at the rate that they provide them currently when you lose 50% of your patient's payer source, or if you have cuts to 50% of your payer source. So cuts to Medicaid don't just affect children who are on Medicaid. Cuts to Medicaid affect all children, regardless of their health insurance status. And are, the reasons why there are long waits for pediatric subspecialists, and there are hard barriers to accessing care currently in place, and that those barriers could potentially get higher. So that's just on Medicaid. When we have kids with rare diseases like CMN or NCM, a lot of the therapies that are being developed or that are currently available are the result of publicly funded federal research dollars, either at the basic science level, just working with cells in a lab to ask questions about how and why this disease happens, or how and why we can help some of the symptoms of this disease for patients, come from small labs that rely on the federal dollars provided or in the form of grants from the NIH. Cuts to basic science research and to clinical research directly impact our ability to continue to better understand NCM and CMN and provide the knowledge required to create new and novel therapies that improve our children's health. Our current, CMN is a very underfunded disease. Even being rare, it has very minimal research dollars from the federal government, and that means each of those dollars is worth even more to our kids. One of the largest researchers, Michael Sargent, out of the NIH, is an NIH-employed scientist and dermatologist that specifically studies CMN, and any changes or threats to NIH funding are going to directly impact his work, which is some of the biggest and most promising that is currently going on for our kids with
For
CMN.
sure.
Yeah.
Yeah, and that just speaks to how those research dollars are so critical for our kids. And you're right, the partnership with the NIH that we've enjoyed, honestly, over the last couple of years.
Mm-hmm.
I mean, I saw it. I tried to say, kind of with my own eyes, like I saw appointments kind of vanish from my calendar. And, as of right now, Dr. Sargent is still at the NIH and is still trying to move his research forward. But it was something to kind of like, I've been in this role for 6 years, and now this is the third, maybe fourth administration that I've sat through, depending on timeline. I've got to map that out. But, it was jarring, the amount of appointments that vanished from my calendar. And I can't tell you if that was because we have more involvement with an NIH, or if it was just, a radical situation there. But at the same time, I'm grateful that the research has continued at this point, and we just need to make sure that we are using our voice to ensure that it continues, because there's not just Dr. Sargent, but there's researchers across the country that are funded by the NIH. If you want to kind of a deeper dive on each one of those, we did the research Sarah did the research for you, helped us with a blog post, so you can go check it out at nevis.org/blog, look for policy in progress. And that kind of details all the federal funding that we kind of see as touching the CMN community right now. And that's very specific to CMN, not counting research that could be going on with hydrocephalus or melanoma or any of these other like kind of auxiliary things that may be challenges for some of our families.
Yeah, and just, another institution that's at play currently, one of our other big research groups is at Mass General Hospital. And for, those of us in medicine, we're kind of intimately aware that Mass General and Boston Children's are all just nicknames for professors who work for Harvard. So any threats to and holding up grants for kind of the whims of the moment really do affect our
Mhm.
kids, and our kids are directly impacted by withholding federal dollars from Harvard currently.
Yeah, yeah, for sure. And I will say that there is a clinical trial that's enrolling right now. It's an adult clinical trial, but it is happening at Harvard, and so that's um, you know um, an interesting dynamic to be navigating right now, and just hoping that research can continue. It is for a less invasive biopsy option and we've got a student that's been working on that with Dr. Hallrick for some time, and hopefully, that research can stay out of hot water, but you never know. Um, and then can you speak a little bit about early intervention and how
Yeah.
many, I wish I had the data to say X number of families that are affiliated with Nevus Outreach are accessing early intervention. And we will have that data coming in NOR. There will be a day where I can give those numbers, but I know that at my own house, we had intervention evaluations. That's just something that we did as a precaution, but there are many, many um, CMN and NCM families who early intervention is part of their everyday plan of care. Talk a little bit about what's at stake there and what we can do.
Yeah, so early intervention is a federal program that provides access to developmentally appropriate therapies and resources for children deemed at risk for falling behind with development or already falling behind with development in either of the major domains of kind of gross motor skills, fine motor skills, speech, language, all the things you fill out on the forms at your pediatrician's office when your child is young and they're tracking their development. Early intervention is implemented or housed under the Department of Education, and it basically provides free therapies and services to all children who qualify for them under the age of 3. And so, especially for our CMN and our NCM patients, but also with all kinds of developmental needs, if they are receiving services in their community, either from PT or OT, speech, and then a lot of communities have even beyond that ways to support families through the early intervention programs. It's not entirely clear at this point in time because a lot of early intervention is implemented by each individual state, how these changes at the Department of Education will impact our kids' ability to access these therapies that they deserve and that are a federal guarantee and right to them. But when we cut services at a federal level, we increase the bureaucracy, we increase the time it takes to get services or money to the people who provide the services, and we potentially kind of knock the legs out of the enforcement in states that aren't providing the services to our kids, and they are the enforcement mechanism to make sure our kids get those therapies. When kids get over the age of 3, at least in the state of Colorado, there's a program called Child Find, and that's when oh my goodness, sorry, when services and therapies start to be brought into the education system. And that's why this is all under the Department of Education, is that's when kids start accessing speech, PT, OT through their educational environment, through the K through 12 or kind of pre-K educational system. IEPs are important for our kids, especially those with NCM, so that they can get the accommodations they need to get a fair and equal education in schools. And all of that is enforced and regulated by the Department of Education. So cuts to the Department of Education impact our kids on many levels, specific, kids who don't have NCM or CMN, but specifically those who struggle with, symptomatic NCM and brain. They have symptoms, neurologic symptoms that impact their ability to kind of live full lives in the way we kind of traditionally think of full lives. A lot of the services and therapies that they get are actually come through the Department of Education and are not traditionally kind of medical services.
Right. Yeah, that's so true. And as someone who has taken a lot of phone calls over the last few years of what are we allowed to put in in our documents at school and those kinds of things. Those kinds of questions come in every school year. And so, we know that affects our families. So just thank you for bringing that to light. And then what do you wish more people understood about how all these things kind of work together? And if someone's watching this and maybe they've got a 6-month-old Nevus owner in their arms, or maybe they're a 60-year-old Nevus owner and just kind of saying, you know what, I'm past all that, I'm good. Like, why should this be important to them?
Yeah, so not only for our community, but for the larger community of pediatric rare diseases, every dollar matters. So when you have a disease that only affects a small number of people, every dollar in the way of research funding, in the way of educational services, in the way of Medicaid care for our population, every dollar matters. And so while what might be small cuts in the eyes of the federal government can actually be really devastating cuts to small rare diseases. And because we have a small population of kids, there aren't a lot of people stepping up outside of the federal government to provide the money necessary to look for new therapies, to provide these services, because it's not a money-making opportunity. So what you can do is you can talk to your local lawmakers, both at the state level. The state level is really important for a lot of these things too, but also at the federal level in terms of your representatives and your senators is tell them that these are important issues for you, that these matter to you, and that you are watching how they vote if they are, if issues come up either in the House of Representatives, the Senate, or at any level of state government. That people voicing their opinions is one of the most kind of effective way to steer local government, local, state, and federal government, especially when there's so much noise out there. Hearing a consistent advocacy from constituents can really change how things play out, especially when cuts are on the line. And because it seems small, but these small cuts really can be really impactful for small and rare disease communities.
Absolutely. And last week we talked to a group of advocates who came and represented Nevus Outreach on the Hill with CSD Hill Day, and we talked a little bit about Rare Across America that's coming up with in partnership with the Every Life Foundation, and that will be an opportunity for people to advocate kind of during the summer break session, if you will. But get on Zoom with your local representatives. That'll just be another opportunity that we'll be sure to share from the advocacy perspective. And really, I would love to have a huge turnout of CMN advocates. I've done it just me myself many times, and then over the years, there's been a person or two that will join, maybe a board member, maybe a committee member, maybe someone who's been in our community for a while. But I really would love to see us kind of storm Capitol Hill, at least virtually, together through that opportunity. And anyone can sign up, and they have a youth program. I mean, even as young, I think as young as 12 can participate. So really, really cool opportunity we have coming up to do exactly that. Make some asks and get in front of your local legislators. They look you up by state, put you with the right people. So you're not talking to just anybody. It's really matched with who your vote impacts. And so that's great. And building those relationships over time really is key for us as an organization, and you yourself as a informed citizen of America, hopefully, trying to do what's right. And so how can pediatricians, speaking to kind of those colleagues, Sarah, how can pediatricians and other clinicians partner with families to help them navigate systems? We'll talk a little bit about this next week too, but just kind of give us a little preview of what that could look like.
So I think, and this, there are always more questions that families have than they ask in an appointment. And so really being vocal about the questions and concerns that you have for your kid and bringing them either to your pediatrician or your dermatologist or your neurologist These are people who are there to help you. You are not a burden to them by asking more questions, and you will serve your child well by asking questions. If you, especially when it comes to rare diseases, oftentimes patients and families know more about these rare diseases than, say, their general pediatrician. I am a pediatrician, and while I don't practice as a general pediatrician, I had heard of CMN vaguely, but until I had a child with CMN and then was like, oh, I need to read up on this. Likewise, Nora's pediatrician, who I trained with, also had never seen a patient with CMN. And so just because you are rare, your child has a rare condition does not mean that their pediatrician can't take good care of them. And even orienting them to the resources you know about can be helpful. We can talk more about kind of specifics of how to do that, but know that pediatricians are advocating for children nationwide in the setting of all of these cuts to, or threatened cuts to Medicaid and cuts to research. But really, if you have questions, ask them, because your pediatricians, if they don't have the answers, they will find them out for you and they will help you access the care that you need.
Absolutely. Well, thank you so much, Sarah. And just to wrap up, one final question. What's one thing that gives you hope right now, or one thing that you'd like our community to walk away with after watching this? I thought that would be a good question just to end on a good note.
Yeah, what you should know about and probably most people know this by interacting with their pediatric dermatologist and their pediatric neurologist or their care providers, is that pediatricians are really passionate about what they do and they are big advocates for the children that they serve. And so know that regardless of what you hear on the news, there are lots of pages and groups of pediatricians and scientists and researchers who study rare diseases that affect kids who are doing advocacy behind the scenes as well. And it's not just parents working on these issues, but know that your voice often matters more than us. Constituents in all communities, your voice matters, and you really can influence lawmakers to make decisions that will better set us up to better address our children's health in the future. And there's a cattail too.
Very well. Thank you so much, Sarah. And what's the cat's name, just for
Well, that
prosperity?
was Lizzie, and then the first one
Ah,
you saw both of them actually.
okay, okay. Well, thank you to Sarah and the Taylor cats tonight for joining us, and we're so thankful to have you on the board and have your important voice in this discussion, Sarah. And we look forward to talking with you more next week.
Perfect.
Thank you. Bye.